One of the things that struck me very powerfully by, I think, the comment from The Economist was the stuff about the American EU trade deal. And the phrase he used was massive, I think it was massive force or massive power to effect a small change. And that resonated with me, because I think if we cannot stop that, then it doesn't matter if you get the Labour Party in, it doesn't matter what you're trying to do to repeal the health and social care, we're lost. So to me, I thought that was quite a big priority. The other one about the PFI that was mentioned, I noticed that Northumberland Healthcare, yes, of course it is. Alan Milburn, my fault, I'm sorry, mea culpa.
No, he's not actually Alan Milburn.
No, I did a
but there was a connection.
The Trade Union Studies Unit for my sins, and I apologise to everybody here, because I think it was a bloody disaster, and the man's a menace. But the PFI that he introduced everywhere and promoted is a real disaster long term, because it's such revenue, and it means that trusts have to spend more and more of their money servicing these private companies who funded this. But it was interesting that Northumberland Healthcare somehow have found the money to buy out the Hexham Hospital PFI just recently. And I think there is a bit of an opportunity there to do work around that. But I think we need to know more about how that was done. So I think this Euro deal with it was local council money. But I don't know how they did that. That's really, I know Ian Sutherland's gone, and he was former leader of the council, but I think that's a really interesting area that we want to put. But I think that this Euro trade deal is the killer one for me.
Okay, so Mike, could you put together a little note?
Yes, I would. I did try and keep it fairly simple to make it clear what it was about, but I will do that. Certainly.
I'm conscious of the fact I should have asked you before. Yeah.
Is that okay?
Yeah.
I'll stand up.
Yeah.
I'll try and keep it as brief as I can. I'm one of the organisers for the People's March for the NHS, the part of the 999 Call for the NHS campaign, which is set up by a group of mums and carers in Darlington. We've been campaigning around the bedroom tax, absolutely angry as hell about the NHS, and we decided one night, camping in front of the town hall for the bedroom tax, we thought, oh, shall we rerun the Jarrow March to try and do something for the NHS? So that's what we do, especially after the march came about after clause 119. We just got so angry, we thought, we want to do this, we're going to do this. We want to obviously draw attention to the NHS cuts and educate people, let people know about what is happening. And, obviously, because a lot of people, are unaware, and it's obfuscated, it's obscured what's happening. The BBC coverage of the march at the Tory Party conference last year, deridedly pathetic. So we want to get as much publicity as possible, highlight, as well the work, how people can get involved to challenge legislation, come up with some kind of consensus manifesto or way forward to how we resurrect the NHS and keep it public. We've got lots of organisations on board like Unite, Public Services Alliance, GMB, Keep Our NHS Public, and People's Assembly. If you'd like to get involved, our email address is there, or come and talk to me after. We've got, I'd just like to say, Alan Milburn used to be my MP, and our current MP is Alan Milburn's secretary. What a surprise. And
Was.
Well, yeah, you know what I mean, was. Oh, there's always one, isn't there?
Yes.
Right. But we've got Andy Burnham now saying, like, publicly, I back this. He said that the market has no place in the NHS. We will personally hound him, if he doesn't live up to that promise. And who knows whether he'll become Health Secretary, he'll continue to be Shadow Health Secretary, or his successors. But, we will not rest, until, the market has no place in the NHS. So we will, we have eyes on him. We'll be serving every MP notice when we get to London. Say, we know what you've done, what your voting record is, and we want to get a conversation going about what we can do to get this back to Nye Bevan's values. Anyway, I'd welcome any thoughts from the panel anyway. That's my piece. Thank you.
It's fantastic what you're doing. I know you've done loads on social media, which is just brilliant, and you probably will do this, but you really should link into what's happening with this Care UK handing the keys back. It's a fantastic example, and it just explains everything about what we're talking about tonight. And it's not happening in many parts of the country, so to hook into that is a really great thing to do. And you know, even after tonight, I'll be talking more about that with the BMA, because it just explains everything about what's wrong, about what's going on.
I was going to respond to sorry. Well, just very quickly. You're always in a dilemma with the existing structures, how much time you put into the university, how you go to groups and things. All I'll say to you, and I suppose I would say this, is please try and use them, because you can highlight issues. In our area, we've had a very effective group that's raised issues about the Durham Ambulance Service. All that stuff that was on Look North was already in the public domain if you wanted to nose about on the websites, you know. And we're putting pressure on the ambulance service to improve it. Now, the big things we can't change without changing the rules. I accept that. But within the existing rules, if people are prepared to get engaged and put a bit of effort in, you can make minor changes, which I'm afraid now I'm getting near the final curtain, so to speak. I tend to think, well, perhaps that's all we ever do. But, you know, I'd rather it was on my gravestone you improve the NHS a little bit than you did nothing at all. Thank you.
Sorry, yes, Peter. One of the things that several of the speakers mentioned in the first part was the fact that a lot of people, many people, don't understand what's going on and how their NHS is being affected. Is it not possible for the organisations that are sponsoring tonight to get together and for a leaflet to be produced which sets out simply on 2 sides of A5 leaflet or whatever the points that have been raised? The national headlines that have been referred to tonight are already there. I think those need to be backed up with local examples, and I can see Helen smiling, she probably already got it and prepared one earlier or something, but local examples from around the region of how what people hear nationally is affecting services locally. And then for that leaflet to be produced, I'm sure we can find somebody to fund it by their thousands and put out through community groups, community organisations. You know, I was talking to a lady there from Durham, and apparently at a stall every other Saturday, is it in the marketplace, where those sorts of leaflets could be distributed. There's lots of ways where we can get the message out, but we need to have a tangible message for people to read. And I think that underpins, for me, all the other things that need to go on in terms of influencing the political machines and so on. I think that's, I'm trying to map everyone, and of course I'm reaching the final curtain too, I suppose.
I've got GPs here, but
well, there is resurrection.
Thank you. I'm Denise Robinson. I'm a gateway counsellor and also a carer. I'd like to back very strongly what you've just said, but of course it's no accident that the way that the privatisation has taken place has left the Labour movement with a very, very complex set of problems as to what we do. Almost everything that the Tories have done leaves any future Labour government scratching its head, wondering how on earth it can be reversed. And that's no accident, that's a strategic approach. But so I like the idea of having a simple leaflet, and best of luck with it, because having seen the diagrams showing what a ridiculous convoluted structure we're now at, and it's not yet finished. it's extremely complicated. Let's hope we can end up with something vaguely similar, vaguely simple. I wanted to go back to what we kind of do, because that was put to us as what we should focus on. It's not just MPs that we need to lobby. Health is now the business of local government. We have health and wellbeing boards, we have overthrown scrutiny committees, all in the business of talking about health and talking to health deliverers, so that lots of councillors are also to be lobbied to take some responsibility for involvement in this new environment. That's something that people can, that's part of the conversation that I suggest we get into.
What these wellbeing boards and the scrutiny committees are and what they, just a quickie on what they do, because people may not have heard of them.
Well, one of the things that came out of the legislation is that councillors talk to health bodies in their civic centres and town halls. That's health and wellbeing boards are meant to be, you know, looking at some kind of public accountability, bringing it all together, because of course there's more to health than doctors, nurses and patients. There are all the other issues. There are the planning issues, there are the supermarket issues, the diet issues, all the prevention issues, and you know it is a quite a full set of conversations to be had in those bodies.
That's the wellbeing board. Now the scrutiny committee.
We review performance and problems that hospitals and health bodies have. We look at statistics, we look at case studies, we look at what's going well and what's not going so well. We're not a decision-making body.
You can ask questions.
We can come to views and we can publicise our views, and it is worth making use of this new structure, albeit that it's a lot more complicated than it was before. But as I say, this complexity, when David says we can't go back, we can't have a reorganisation, I'm thinking, so we're stuck with this? It's not fit for purpose as far as I can see, because it's not clear. There's too many bits hanging off the edge. So I'm not sure where that comes from. I don't know if that's the view of Andy Burnham, and Andy Burnham doesn't own kind of the way forward. He is one speaker, and I'm sure lots of people have got views to contribute to the debate. But I think when we're looking at the NHS of the future, it's not just about hospitals and doctors and nurses. We need to think, what the hell has happened to dentistry? What has happened to prescription charges? There's a lot more that we need to get wrong, other than just reverse the last privatisation. Prescriptions are unaffordable for lots of people now, and don't get me going on dentistry. It's unaffordable for a lot of people, and that then contributes to poor health in other ways. So I think we need to look at that. As well as being a councillor, I'm also a carer, and carers prop up the NHS to a massive extent, tens of billions of pounds every year, and that is all part of the small government model. Let's spend as little as possible, because of the mess that the banks left us with. But we have to resource carers, because carers, being part of the community, are important players in the health and well-being of communities. And so we need to be looking at changes as regards carers as well. And I just kind of finally mention Mid Staffordshire, which I think took everybody up short just over a year ago. Things going badly wrong in our health service. And in the context of that shock, the shiny models of all these private companies, I think, reassure some people, because it was the NHS that was doing all these wrong things. And I think we need to be very careful about the tone of our debate and what we pick up private companies for and their involvement in our NHS, because the way that the Mid Staffordshire agenda was played, I think, did more to make people anxious than a lot of people realise.
Can I just go back to dentistry for a minute? The children's orthodontics in this area was put out to tender about 2 years ago. The specialists who operated out of the Terrace and Jesmond, I'll not name names, failed to get the tender. It was given to another practice which didn't really have the expertise. They had one orthodontist. The thing that I've heard most recently, this is 2 weeks old, this information, the children who go to that practice are treated 4 at a time in one room. The people who are doing that work on the children's teeth are not registered as orthodontists, so they're not specialists, they haven't completed all of the elements to call themselves a specialist. The contract says that they must have specialists. How are they getting around that? The one specialist is linked by telephone. I heard about this because somebody who's got a disabled child is now paying for the orthodontist's work because they don't want their child in a room with 3 others being treated all at the same time. Now, how do you get that out? How do you get that story out? The people who are taking their kids, they don't know that that's not how it happened for us. When we took our children to the orthodontists, it was done by registered specialists, 1 at a time into a room. The woman whose child has the disability was told, well, if you want the child to be treated on her own, ring up ahead and we'll give you a room where she'll be treated by herself. So that's a local story. I don't know who was looking for local stories, but that's a local example. It's hidden. Who knows? Nobody. Except me, you all now.
Can we go around everybody and then we'll have well, yes, fine, yes. Don't you get a bit,
it's linked to what they've said.
Right. Now, if you could be quite quick.
Yes, I'll be brief. Just when people started mentioning dentistry and prescription charges, I think it's always useful if people who've worked in specific areas, who spotted specific things, can make them public for the rest that's interested. Just two quick small facts. Over the last couple of years, there's something called mental health advocacy I mentioned earlier, where the people with knowledge of medication and law and treatment help someone suffering with mental health difficulties go through their appointments. The government tendered 2 statutory contracts to try and cover them. Independent mental health advocates and independent mental health capacity advocates. Capacity advocates assess where they can be treated under capacity law, and the other ones are basically just a very, very cheap version of a mental health section in tribunal solicitor. That covers less than 10% of what advocates actually do. There is no statutory contract for advocacy. Also, I was brought in to help close down NHS Direct, taking the mental health calls as it closed down. Well, it transferred over to 111, and I cannot in all good conscience tell anyone I know to use either of those services. I couldn't, not in all good consciousness. It is frightening. And the people answering your calls take a 2-week training course on how to run a computer program and click yes or no. They do not know their arse from their elbow.
And you wonder why candidates fall
Yep.
in with service start code.
I've really been grateful. I've got something stuck to my bottom, but never mind. I'm sorry about that. It is the People's March for the NHS. I've been grateful for those people who called for a pooling of the brilliant things we've seen here tonight into a simpler form. And I know there will be a leaflet, I'm sure it's great. I'm actually thinking of something which combines 2 things. People in this room have had the level of energy to come out, and I'm sure they go to other meetings as well. When I was leafleting for the local elections, try and keep UKIP out, we know how many people said, I'm not going to vote, or I'm going to vote for UKIP. And I think we've got to get to those people with even simpler leaflets. I don't mean this in a patronising way. I think, I was on St Mary's Island when my partner was rescuing a seal, and the marine mammal medics, who are lovely people who put their lives at danger to help animals, and I was saying, come along to this meeting, and they were going, why? And they just didn't know. These are intelligent young people. Well, the NHS has been dismantled. Yeah, it's too late now. There's this awful passivity.
Yeah.
So I think it would be brilliant if somebody could collect the links, if you don't mind us having at least the links to the facts that you've done, so that we can propagate that through our various organisations and this. But the other thing I think is the stories. Because people are attracted. The thing that I remember most about David's brilliant speech was him standing in the middle of Lancaster, did you say? And people just not interested, not believing what was happening. And I think you've got to tell people, stories tell people. And there's got to be some way in our various websites that you can ask a neighbour or a friend or a member of your family or yourself and use your own story to get people. And the last thing is, what we need is not just contact your MP, but here's the kind of letter you can send to your MP, over and over again, putting those links up and the link to your MP. I think make it easy for people because they're tired, hungry and pissed off.
Yep. Okay. I just go straight to the back. Yeah.
I think if we're talking about fighting back and what we actually do to save the NHS, I think one of the best examples comes from the fight back that's currently going on at a care home in Doncaster. I know Martin will know about this. But there's a care home in Doncaster that used to belong to the NHS, was recently privatised, now belongs to Care UK. Now, as soon as that was privatised, Care UK started to cut the wages of the staff working there and also the conditions. And what this meant for the patient was a very real deterioration in the conditions in which they were looked after. But I think one of the most inspiring things about that is that the care workers there are actually currently ongoing, taking strike action, all-out strike action to stop that from happening. And I think that's one of the most, that's one of the best things we can actually do to save the NHS, is to support people like that when they go on, when they start to take strike action, when they start to take do things like that. And I think this. So I mean, what I'd like to finish on the 10th of July, there's going to be a massive strike right across the public sector that could involve 1 million people. Now, it's about strictly it's about pay, but I think we all remember from 2011. When people start to take coordinated strike action against this government, it becomes a lot more political. It becomes really a strike against the entire agenda of this government. So what I really want to do is actually, I think we should all follow the example. We should all support strike action like when it happens in Doncaster, and also support the examples of strike action that are coming up, because like I say, I think that's the best thing we can really do to start defending the NHS.
More on the Green Party. I'm just following on really from what that person over there was saying. I'm wondering what the trade unions are doing, what the TUC are doing, Unite, GMB, Unison, because they've got the leadership, they've got the finances, they've got the resources to educate the public as to what's going on. And I mean, I went on the march in Manchester last year, and it was a brilliant march, and there were thousands and thousands of people there, and obviously it got practically got nil media coverage, but nothing's happened since then. And I think there must be ways for the trade union movement to really get out there and campaign for the NHS more specifically. I mean, the call for action July 10th is about terms and conditions, which obviously feeds in to what's happening in the NHS as well. But I think there needs to be a lot more coordinated action around the NHS issue, and I think it would be very, very, very popular. But
yeah, okay, but don't let's forget the journey of 1,000 miles begins with a single step. So in a sense, it's not what they can do; it's what we can do. Yeah. Sorry.
Louis said that Love Council in Luddington, up the road.
Sorry, can you speak up?
Sorry, local councillor in Leamington up the road, Newcastle City Council. Health Scrutiny Committee, I'm on ours as well, has the delightful power to haul people over the coals when they let the city down. So we were able to, when they tried to close Scotswood GP practice in, we were able to bring NHS England in, demand they account for it, and now we have several select committees looking at folk care as well, and asking them to explain themselves, which appears to have put them wonderfully, and at least prevented them from immediately closing the Scotswood GP practice, but I don't know what's going to happen 12 months down the line. So by all means speak to your local councillors and get them to do the same thing, and when someone messes about with healthcare in their area, say, okay, but the health scrutiny would like to see you now, please, and you can explain yourself.
Can members of the public go along to the health
All
scrutiny
health
committee
and
ask a question?
Our health scrutiny meeting in Newcastle is a public meeting. The chair can choose whether or not she wants people to speak. Our chair always does. Wendy always does.
All right.
She's a Lib Dem. So Martin Manasseh, who is a member of Keep Our NHS Public, attends all our health scrutiny meetings, and we are always delighted to hear his questions, and we like hearing a member of the public questioning. I don't know if it's the case of Gateshead, probably. I don't know what your chair's like. Secondly,
can I just say Durham? I sat on Durham for some time
yes.
as a district council member, and then
Yes.
I was co-opted after that. No, can I just say how it worked? The members of the public or groups could send issues in, and the chair could take them and
Yes, I think that's
investigate.
Did they
That's
have
getting
the right
us
to
to-
turn up and speak?
Oh yes, very much.
Oh yes, anybody can show up. By all means, show up. It'll make it more exciting. When the Scotswood GP practice problem was coming, a whole lot of patients with Scotswood GP, we had to put extra people in the room. It was brilliant.
Right.
The second part is that what can we do? There's something. I don't know if anybody's mentioned social media now. A couple of people have, but there's something that I think of as activism spamming. There was a post, somebody had put up something for Another Angry Voice, the Yorkshireman fellow who just keeps putting out graphics over and over again, explaining things to people, which then get shared widely. That's quite a simple thing to do as long as you've got Photoshop. I tried to make one that was, I went back through all my health scrutiny meeting minutes and I counted all the number of mental health wards that were being closed one after the other. I counted them up, I put it down as a big headline and put, this many mental health wards closed in Northumberland, put it up against a picture, and then put it out, and Martin Manasseh was finding to share it on the Facebook group and so on. The social media is quite a powerful tool for just engaging with younger people, but a lot of older people are digitally included as well. And if we can, there's some way we could just churn out loads of things on Twitter about this is where the stories come in that people are talking about. If you can tell, you see these Britain First me everywhere with like, this person was put in hospital by some Muslims or some other nonsense, and then go all over the internet. And they're quite often completely untrue as well. So I don't see why we can't do that. Just keep churning out those sort of little pictures. I mean, the guy from Another Angry Voice just puts some text on a black background with one picture and sends those out too. So I think we've got Twitter accounts, we've got Facebook accounts. There's no reason. All you need is somebody with Photoshop who's willing to sort of put little memes, they call them, on the internet.
You see, before you reach your final curtain, you've got to go on Facebook.
I hope it's on.
Yeah, Diane Jones. I'm very involved with Red Labour, and I'm a sort of rejoined Labour Party member, still somewhat ambivalent. There's been some brilliant ideas about what we can do, but I'm interested to hear people's views on how we should go about trying to influence the Labour Party to actually do whatever they possibly can when they get into power. There are 2 more days for anybody who wants to go on the Agenda 2015 website to give your opinions on their policy documents, one of which is on health and care. But beyond that, I mean, I'm not really quite sure how we go about that.
Frighten it. Frighten it. That's how you influence the Labour Party.
Yes, I think that's the only point.
Actually, no, I'm not sure I quite
You always were a right winger.
I'm not a right winger.
Just a few things about the Labour Party. One is that we've now got 2 excellent MEPs in this region, and I didn't know whether any of the groups, either Red Labour or Keep Keeping Our NHS Public has contacted either Jude or
Yeah.
Paul so far, because clearly there's a European dimension to this which they need to be on top of. So that's the first thing. The second thing was that 38 Degrees, if people have subscribed to their posts on their emails, they've been really effective at raising issues with MPs. And I went along to one thing about the NHS. They had sent out an email saying, if you would like to go and lobby your MP, write back to us and we will organise you. So I turned up at my MP's surgery with a whole bunch of people I didn't know, and we all sat there together, and Nick Brown, who's the Labour MP, who was entirely in agreement with us, listened to us and then talked about what he wanted to, how he wanted to respond. It was really effective, and all we did was go along to his surgery on a Saturday morning, and I think that's really effective. So I would urge anybody to do that. But I think the other thing is about using 38 Degrees to get out that massive message and to circulate your materials. They have thousands and hundreds of thousands of subscribers, and they focus a lot on the NHS. And I think we need to use that both to put pressure on the government and also to put pressure on Andy Burnham and the Labour leadership, having, as Diana says, written to comments to Agenda 2015 before the end of Friday.
Okay. I'm just a layperson here. I haven't got a medical background or anything like that. I'm just picking up on, we're talking. This has got to be a multi-pronged approach. We're talking about lobbying MPs. We've got many people from medical backgrounds and professional backgrounds. What we really need to do, and the person from the Green Party and somebody else touched upon it, is actually reaching out to the people who actually use these services, the people out there, Absolutely. And I think we've lost I know we're from, more left-leaning people in the Labour Party. It goes far further than that, and it's a case of people have been in power and watched their own burn, the Labour Party can't wash their hands of what's going on. They were in power for 13 years. You've got to reach out to these people. We're living in a political climate where I take on board that we've got things like social media, but what that encourages is slacktivism. It's not activism. It isn't doing anything apart from ticking a box on a computer and thinking you've done your bit. You've got to do more than that, We're here tonight. Basically, there should be a great big hall. It's been a good attendance. Should be a great big hall. We're not reaching out to people who've used these, who are suffering from the cutbacks, and that has to go far beyond what we're talking about, lobbying MPs. And the only way, and it's to follow up the point, is the issues on your doorstep. What's happening with your, in Scotswood or Elsick or wherever it is. We have to focus on that, because what we're living in and widening out with the wider political climate is people like simple messages. There's a reason the right wing are on the march. All those people who take time to read about it know where these people are coming from. People want a simple message, and people who are getting the simple message across are completely disingenuous, haven't got the interests of anybody at heart who are actually voting for them. And this is what the Labour movement, I'll use, not the Labour Party. I'm not a member anymore, probably never will be again. But when the Labour Party lost those people a long time ago, and they're the people who are trudging around Newcastle who won't listen to you when you stand outside the monument giving your leaflets out. The only way you do that is by getting out there where it's happening on the doorstep and engaging the people. And for all the well-meaning people in this room, I want to find something that's going to come forward where we get out there and you meet them. And it's not a case of, yeah, we've all got jobs to go to during the day, but it's the people who are speaking complete sense who are experts in this forum now. Not me, I'm not an expert in any health issues, but I'll be there. But you need people to engage the end user, and that's where it's all gone wrong for the last 20 odd years,
I worry about this talk about striking and things like that, because you can have a march with being on strike, but you can just as easily have a protest march. And I feel as though a strike as a move straight into the hands of the right wing.
Absolutely.
I mean, I've been on strike in the last 18 months, first time in my life, and there was more people working than was on the mall. And it was just, I just felt it was a waste of time. Well, it wasn't a waste of time, but it would have been just as well to have been a protest march. I mean, we all ended up in York and we had a good day, and it was like a lot of people turned there, but it didn't appear on the television at all. And I'm not a person for strikes. I think it just plays straight into the hands.
I was on strike for 7 months in 1978-79, the social workers' strike, and we got hammered from the council that we were striking against. Jim, you'll no doubt remember, and by the public and by everybody. It was, you know, we were supposed to be helping people, blah blah blah. You know, that was in the days of, it was still the Callaghan government. In a way, we were part of the winter of discontent that brought Labour down. And it was so ineffective.
I was on a one-day NHS strike, and immediately, admittedly, the NHS coverage wasn't very good, but the amount of people that drove past and beat their horns and
Oh yes, you get that.
Which, you know, normally you think the NHS, they think, oh, people on strike, that's going to affect our health. But, you know, a lot of people are very
long ago we got that as well. It was positive. But
Is it me or?
Well, there was a guy next to you, and you both wanted to say something.
I'd just like to, in response to what you said about what trade unions do, and I'd just like to share a little bit of a strategy that Unite's just adopting. I work for Unite, but I don't work in the health sector. I work for the department organising and leverage. You might have read about us in Daily Mail. We're the ones that, where industrial relations have failed, where strike action or dialogue's broken down. We do intense research on decision makers in a process, and then we try to push decision makers by exposure. And I'd like to pick up on some points that you said, Ellen. Absolutely. The people that we need to expose in this process are actually the private companies, but even more so the MPs, the 280 MPs that have got the fingers in the pies in those companies. You know, because if we really get into that spider's web, they're in, and some are Labour, some are Liberal. We've got them all listed. We're going to out them and expose them. But the problem we've got with the NHS, and we've been tasked in our department to kind of push and support and mobilise on the ground in terms of what can we do about the NHS and how can we bring this and widen the political debate in it. And our strategy is really quite simple in one, although it's not simple, you know, research, diagrams, CCGs, whatever, it's really taking a lot for us to get our head round. What we want to do is expose some of that, because there is the media block, a massive media block. I'm in Manchester, I've been in London. You can put 500,000 people on the streets protesting, but when it don't get 10 minutes on BBC News or, you know, mainstream papers, then what is it for, really? We're preaching to his own, we're preaching to converted. What we need to do is widen that political debate in constituencies. The people that affect, normally we pressure shareholders, stakeholders in business, and we'd highlight and expose in them. In this instance, the shareholders in the NHS are absolutely what you've just said and what you said. They're the people that use it, the general public. So how can we widen that debate to them? How can we change that political debate? How can we expose what's really going off in terms of these private companies, the TPIP agreement? That, you know, that's if that all fails. What our strategy is at the minute is we're looking at every bid. We're looking at every bid in NHS that's currently out there. We've put freedom of information requests in. We've got them all. We've got the ones that's gone. We've got the ones that's come in from some CCGs. Some we're labelling them in two categories, either angels or demons. They either share that information or they send us a letter back telling us to look on web page. So that's dependent on that responsibility strategy that we use to expose. So
So once a bid's gone out, we're looking at it. We don't know who bidders are. You can't get that information because that's in competition rules. Absolutely. So you don't know who's bidding for it once that process has gone out. But what we've got to do is raise awareness that these snippets at NHS are out there for sale. You know, we've just done a load of work on a depression and anxiety unit in Hull that's now been, you know, it's been tendered out. But do the constituents around that hospital know about it? Do the stakeholders in that, the general public, know about it? No, because it's all under wraps. It's not transparent enough. I will try and keep it short. But basically, what are you not doing about it? I'll keep it as short as I can. I'll try not to speak, really. I'll come to listen. But what we want to do is we want to create and build an alliance, a massive alliance, because, you know, Save Our NHS have got their agenda. We need to bring everybody together. We need to support. We need to build an army out there. And we need to raise that awareness, and we need to expose what's going on. And then we need to, how do people change that? We change the political debate, and we hopefully change it at the ballot box. But we also bring decision makers to account. So these MPs, they've got to be exposed when they've got the fingers in pies, whatever the party they belong to. And they've got to be committed, pledging, somebody said it earlier, they've got to pledge to repel that act, because it doesn't matter if we turn bids over one by one, it doesn't matter. If that act's still in, there'll be 1,000 more bids. You've got to take the market out of the NHS. And Unite have got a clear strategy, and we want to engage with all of you. So if anybody's interested, then come and talk to us or talk to Martin.